I feel great. It actually did not hurt nearly as much as the flu shot that I received earlier this year, and I'm really excited about it.
I have to ask, some of your employees are getting vaccinated behind you. What do you feel when you see this happening in real time?
I'm so proud of our hospital, and I'm so proud of our community of coming together. I know that there has been a lot of angst related to both the groups that want to get the vaccine and the ones that are less sure. But I think that we as a community really believe that it's our obligation to our patients and the families that we serve, as well as our families at home. I also believe that the benefits outweigh the risks, and so it's as part of being part of a healthcare community, this is the work that we do.
You had said earlier today to one of my colleagues that part of the reason you're here is to set an example.
Yes. When you are in healthcare leadership, it's important for us to not just talk the talk, but walk the walk. And so when I was asked if I would be willing to get the vaccine first, one of the first people in the state of Rhode Island, it was a no-brainer for me. This is important for people to see that I'm willing to get the vaccine, I'm willing to protect my patients, and I'm willing to protect my family.
What would you say for people at home who might be on the fence about getting it?
I think we have to be driven by history, and we have to be driven by what the scientists are telling us. Dr. Fauci is somebody who's been leading this national effort. Behind me, Dr. Raymond Powery, who's our Executive Chief of Medicine at Care New England, have both highly encouraged the public to be able to get the vaccine. And I listen to those who are much more knowledgeable than I am and have more information. And so I felt like it was the right decision for me, and it was the right decision for my family.
What does it feel like for your hospital to get some of the first doses?
Oh, it's so exciting. We care for very vulnerable patients here. And even though we don't have as high levels of COVID patients as maybe some of the other hospitals in the state, we do care for some of the most vulnerable patients in the state. Right above us, 2 floors, we have 53 neonatal intensive care unit babies today. So it's highly important for us to be able to care for both those babies and their mothers.
Just feel like it's coming to an end.
It feels like there's a light at the end of the tunnel. I'm not sure I can say it's coming to an end yet, and I have to agree that many people have said that it might be a really dark winter as we get through, but this feels like we actually have a solution. We have something that we're running towards, and I am looking forward to summer more than usual.